All right, let's move on to the femur. The femur makes three joints. We have the hip joint, which we've already discussed as being a ball and socket with the acetabulum. We have the patellofemoral joint. Down here is the patellar surface. It's the very distal end of the bone. I just marked it in red. That is a synovial planar joint. The patella makes its own joint with the femur that is not part of the knee. The knee is a separate joint and is that bicondylar joint. So let's look at the proximal femur. Now, I took close-ups so we could see the various pieces. We have the head of the femur, which is very smooth. I put it out in class where you could indent on that divot, which is called the fovea capitis. You would be responsible for identifying the head. I would not make you identify the fovea capitis. The neck of the femur is what I said is the weak point on the femur, because if this region receives a lot of stress and the spongy bone on the inside becomes weakened, this is where the hip breaks very easily, and then the person needs a hip replacement surgery. Laterally, we have this great big hook of bone called the greater trochanter. Now, there is a little ridge here called the intertrochanteric line. It's in the lab book, but I'm much more interested in the greater trochanter and the neck here. Posteriorly, we still have the head and the neck. Here's a different view of that greater trochanter coming around. But now in the posterior, you can see the lesser trochanter. The lesser trochanter is important for the muscle known as iliopsoas, so that's why we have to know it. And we have this whole region here that I've put double lines for G. G stands for gluteal tuberosity. This is where gluteus maximus attaches. So gluteus medius and minimus attach to the greater trochanter, which is superior to G, which is the gluteal tuberosity for gluteus maximus. That superior inferior orientation is how you remember that gluteus medius attaching to the superior landmark gets the superior gluteal nerve versus gluteus maximus, which attaches to the inferior gluteal tuberosity, gets the inferior gluteal nerve. Think inferior here versus superior. Down the posterior of, this is the posterior of the femur, and the key here I wanted you to be able to pick up on was the linea aspera. That means the rough line. This is the insertion for all of the adductor muscles, so I wanted you to be able to get a good view of that. If I look at the distal end of the bone, I'm looking at the anterior where we have this is the patellofemoral surface. That's where the planar joint for the patella is. We have the condyles, or the epicondyles rather, to either side of it. But really what I'm interested in here is in that adductor tubercle, because when we look at the posterior, we see it much more strongly. Here's that adductor tubercle. And that's where I drew that picture of the femur with the adductor magnus muscle. The key with the adductor tubercle is it's for adductor magnus, and we get that muscle that creates the adductor hiatus, which is so important for the arteries and the veins. So you must be able to find your adductor tubercle. Remember, it's right in line with the head. You come straight down from the head and it's that point. And then we have the medial and lateral condyles to make the bicondylar joint. Bi meaning two, you have a medial and a lateral, that's two for bicondylar. And the intercondylar notch, some people call it a fossa, but notch between them, that is for the attachment of the ACL ligament. That would be the anterior cruciate ligament, which is the one that many people injure when they injure their knees. How do you tell right from left femur? So we start with the head is proximal and the head is medial. Yes, you can use the same landmark for two things. And then we say, okay, all of the interesting landmarks are on the posterior, the lesser trochanter, the linea aspera, the gluteal tuberosity, all posterior. Or you could simply say the anterior is smooth. But I've given a picture. These are not a matched pair from the same person, but at least it gives you the idea of the right versus the left. They are mirror images of each other. Let's move on to the patella. What do you have to know about the patella? The patella is a sesamoid bone. You must know that. You must be able to correctly identify the patella with its correct name. Do not call it the kneecap in class. It is now the patella. And The fact that it is a sesamoid bone means it grows in the tendon to stabilize the tendon. The good news is you do not have to tell left from right patella. That's just one of the little bonuses, but you do know that it needs to make a synovial planar joint with the femur, and the key is that sesamoid bone feature.